Hey everyone, Dr. David Thomas here, physical therapist for Cadence Physical Therapy. Today I wanted to talk to you guys a little bit about some of the top causes of knee pain. I've been having numerous patients and people in the Buffalo Grove area reaching out to me, asking me to talk a little bit about some of the most common causes for having knee pain. Knee pain can be caused by numerous activities, numerous issues, and limitations. So one of the causes, top causes for knee pain is improper shoe wear. So individuals who like to wear flip-flops, sandals, flat-soled shoes without any arch supports, people who like to wear high heels a lot, whether they have to wear them for work or they wear them when they're going out. Ensuring you have proper shoe wear that has proper arch support, enough cushioning, and even enough room to narrow shoe boxes at the front can cause issues and contribute to knee pain. Having too firm of a heel pad can contribute to having some knee pain. So getting proper assessment and evaluation for the shoes that you wear throughout the day when you're participating in sports or recreation activities, that's really important. So besides shoe wear, another area to be looking at and assessing for a cause for knee pain is gait or your gait mechanics or body mechanics while you walk. So individuals who typically lack that heel strike, so when you swing your leg over and you make that first contact with the ground, individuals who don't have that heel strike mechanics or don't use them and intend to either hit the floor with a flat foot or even worse with the front of their foot, the forefoot, puts excessive loads onto the knee joint and doesn't really recruit that posterior chain or that hamstrings and glute activity, and puts a lot of load through the knee joint and also creates this quadriceps dominant movement. So having your gait mechanics assessed, whether you're having that full sequence of heel to toe at the end, toe off at the end, is super important, especially for those of you who like to run or jog, either at the gym or when it's nice outside. Gait mechanics is another one. So another issue too is a lack of flexibility. So especially most of us, I'm even sitting right now myself in a chair. So those of us who have sitting jobs where you're working on a computer for extended periods of time and not really taking breaks, you have shortening of a few muscles, right? So your hamstrings at the knee joint start to become restricted and stiff. Your hip flexors at the top of your hips also start to become stiff. So over the years, you may not experience problems, but over time, you might experience some hip or knee pain. And that can come from a lack of flexibility, especially in modern day society. We're always sitting, we're on a computer, we're on our tablet, we're on our phone. And with the modern technology and, the work that's expected of us in, the modern day is different. So we're not really standing as much, we're not walking as much. So checking flexibility is a huge issue. Something I see a lot with most of my patients who have knee pain, they have something that we call in the rehabilitation world, quadriceps dominance movement patterns. So essentially what that means is when doing any functional movements like the squat, the lunge, or a hip hinge or deadlift, or even bridging, a lot of the patients have these quadriceps dominance movement patterns. And all that means is the patient is over recruiting their quadriceps for activities that challenge the legs, and they're not getting as much engagement from the glutes or from the hamstrings. So when there's this quadriceps dominance, this asymmetry of strength between the quads, and which is the front of the thigh, and asymmetry with the glutes and hamstrings and the backside being weaker, that creates a lot of torsion and a lot of forces and pulling on the quadriceps tendon, the patellar tendon, and leads to more ground reaction forces when you're walking. So weak glutes and weak upper hamstrings can also be a massive contributor to this. So in addition to the few things I mentioned, so proper shoe wear, checking out your gait mechanics, or walking and running mechanics, and thirdly, just looking for asymmetries between the leg strength in the back, meaning the glutes and hamstrings, which are typically weak, and over dominance or overutilized quadriceps in the front. And then of course, flexibility is a huge issue too. Hopefully this helped you guys. If you have any questions, again, please feel free to email me at davidthomas@cadence-pt.com. I'm looking forward to hearing some of your feedback and question, guys. Thanks a lot. Take care. Bye-bye.